In his 9 years at the regional hospital, Dr. Mark Henderson has never seen occupancy so high at this point in the year. This summer, the hospital has been at surge capacity, or gridlock, a whopping 90% of the time, significantly higher than the 20% he's come to expect.
We've really had record occupancy going back over the 9 years that I have worked here. In fact, when we looked at statistics, we've been 6% busier this year.
The delays stem from a lack of beds. Currently, there are 71 alternative level of care patients in the hospital, patients who no longer need acute care but are waiting on transfers to another location. That's 51 more patients than the 20-person maximum. On top of that, long-term care is also over capacity.
I think we have roughly 20 patients in the regional hospital who are waiting to go straight to long-term care. That's way more than we should never have more than 6.
The hospital is working to improve their efficiency, but part of the issue is the 64 empty long-term care beds at the original Hogarth Riverview Manor that can't be filled.
We have 64 vacant beds at Hogarth Riverview Manor that we can't begin to occupy because we have a lack of human resources, specifically personal support workers.
The lack of personal support workers is an issue that stems across the province and much of the nation. And unfortunately, there's no end in sight.
There's a large population that's going to get older yet that are going to need care, that we simply don't have sufficient resources even now. And so we're trying every creative, innovative strategy, every recruitment effort, partnership with the college, with the private colleges, to really see what we can do to get people interested. The gap is going to widen for sure.
Well, currently those 64 beds are in a state that's known as abeyance, and they'll stay that way until the rest of the year. However, come 2018, St. Joseph's Care Group and the regional LHIN will have to decide whether they want to extend that abeyance and leave the beds empty, or whether or not they finally have the staff ready to open them. Colton Prail, TBT News.